Hi guys, welcome back to my channel. Today we are going to learn a new topic and a very important topic, that is venipuncture. Let's start with the pre-procedure. Before the procedure, we will introduce ourselves to the patient, then we will confirm the patient's name and date of birth. Then we will explain the procedure and obtain the patient's consent. For example, I would like to take a blood sample from you to check how your kidneys are working. This is a quick, simple, and routine procedure which involves inserting a small needle into one of the veins on your arm. You will feel a sharp scratch when the needle is inserted, and there may be a little bit of bleeding afterwards. Do you have any questions? Then we'll perform hand hygiene and put on the gloves. We'll prepare all the equipments needed. We'll position the patient in sitting position and we'll ask the patient to remove tops or roll up their sleeves. The necessary equipments needed are gloves, needles, the hub, evacuated collection tubes, alcohol wipes, syringes, bandages or tape, gauze sponges, requisition form, tourniquet, sharp container. We'll start the procedure by inspecting the hands for previous puncturing sites, bruises, scars, tattoos, or rashes. Then we will apply the tourniquet proximal to venipuncture site in the antecubital fossa. Then we'll select the vein by palpation. The bigger and the straighter the vein, the better. The vein selected is most commonly median cubital vein in the antecubital fossa. Then we clean the vein puncture site 3 times, twice with the alcohol gauze and once with the dry gauze. Retract the skin and stabilize the vein. Afterwards, puncture the vein with needle at 30 to 45-degree angle to the skin. Fill the necessary blood collection tubes. After acquiring certain amount of blood, remove the tourniquet and then remove the needle. Take a cotton ball and press on the puncturing site for at least 30 seconds, or ask the patient to do so. Immediately discard the needle in a sharp container. Afterwards, apply the plaster. Post procedure. After the procedure, we will ensure the patient is comfortable and we will thank the patient. Then we will dispose the clinical waste in a clinical waste bin. We will remove the gloves and sanitize our hands. We will label the bottles including clinically relevant information, example, the puncture site and, and any antibiotics that the patient has been taking. Then we'll fill the blood request form, convey the samples to the microbiology laboratory without delay, and we will document the procedure. Let's summarize the procedure. Think there is a patient in front of you and how you'll start the procedure. Let's start with introducing. Hello, I am Dr. Diana. Can I know your name and date of birth? I'm going to insert a needle into your arms and it will be little uncomfortable. Are you okay with it? Let's perform hand hygiene and put on gloves and prepare the equipments on the table and position the patient in a sitting position and ask to roll up the sleeves. We'll inspect the hands for any bruises or any previous puncturing site and we will apply the tourniquet proximal to the venipuncture site. Then we'll select the vein by palpating it and cleaning it 3 times, 2 times with the alcohol gauze and 1 time with the dry gauze. We'll retract the skin and stabilize the vein, then insert the needle with 30 to 45 degrees and we'll draw the blood. After getting a required amount of blood, we will remove the tourniquet, then we will remove the needle and we will gently press the cotton ball and say the patient to hold it. We are going to dispose the needle in a sharp container and We will dispose other clinical waste in a clinical waste bin. Then we are going to thank the patient and ensure the patient is comfortable, sanitize our hands, and we'll document the procedure. Thank you for your attention. I hope it helps you. Don't forget to like, share, and subscribe my channel.